Oh, hi, I'm Tracy. I have a rare condition called Ehlers-Danlos syndrome, and when I got injured, that meant that I needed a multidisciplinary team to help with my injury rehabilitation. The team's very important, working together to do that, and I have Emma from the DHB who's been doing the tailored physiotherapy exercises. I have Jana who does the manual therapy needed for the program I'm on, and Dr. Burling does the injections into my ligaments to help heal the injured tissue.
So to have Fraser come on board and do what he does, and Emma to come on board and do what she does, we've just seen a marked improvement in Tracy's mobility and function, and it's been really exciting.
I came on board with Tracy about 4 years ago now and started working with her with the physio. And I find it really helpful as part of a team to know that if I'm struggling with something that Tracy's working on, I've got backup in terms of, of Gina and Dr. Burling.
And my job as a role as physician and rheumatologist has been to firstly come on board with Tracy's initial diagnosis, and Tracy was one of my first patients with Ehlers-Danlos syndrome. And it really has been a coordination of care. It's not just about the soft tissue treatments which strengthen damaged ligaments, but it's also been about getting people like Gina and Emma on board to direct care further, to help understand what's happening to the body, how we can coordinate that treatment to better facilitate a good outcome. And the result is that Tracy's come a very long way from where she was 6 or 7 years ago.
Yeah, I could not have got where I am without each member of my team, and alone I would have got nowhere.
Key also is remembering that there are other people in the MDT who aren't here, such as orthopaedic surgeons, gastroenterology people, other physicians who have been involved as well.
I think the other part of the MDT that we've kind of missed already is also Tracy's family. Her son and her husband have really helped guide Tracy through some of the exercises when I'm not available to be eyes on. We underestimate how much help we get from the people around you as well.
I also initially taught Nigel some techniques so that he could treat Tracy when I wasn't available, or if something happened in the night that he had to deal with.
Likewise.
Yes.
And Emma reached out to Kevin Muldowney because my husband was struggling to relocate partly dislocated ribs. So she reached out to Kevin Muldowney, who gave some instructions that worked. So most of the time, about 80% of the time, Nigel can get a rib back in if it's out.
So I reached out to Kevin Muldowney, who is a physiotherapist in the States who works exclusively with the population, and he was actually able to help me a lot as well. And so he's kind of a very satellite part of our team as well, but he's still there in the background. He never fails to respond if I need anything.
And he's also helped each member of my team. Has always been in contact with you. I've been in contact with Gina through me, and contact directly with Emma as well. So he's been involved in communicating with all members.
And I've actually found Kevin Muldowney's program, in terms of, while it was designed for Ehlers-Danlos, I find it's been actually very helpful for some of my older population because the exercises start at a lower level and they work their way up, and I've actually integrated them into my practice quite a bit.
And I think for me, I was managing my physical therapy, which is important, using pretty much any standard program until I got injured. And once I got injured, that's when the wheels fell off and I needed the tailored program.
I think Tracy has really been the key person in getting us all together. She's certainly been no shrinking violet in all this, because she's the one who has got us all together and been willing to have a go at what we all did.
And the interesting thing about a multidisciplinary team is the number one coordinator is actually the patient, how much they're willing to have, how much they want to do. And most people actually really want to get better. And it's really important to understand that the multidisciplinary team is putting the patient first. Definitely a multi-directional street. It's not a one-way street.
And I think for me, I've had obviously quite a few surgeries because of my condition. So I have had a lot of medical involvement that has been successful, but this is the first time I've needed a team to work together this way. These injuries were so major, I wasn't able to do my rehabilitation. I wasn't able to progress, and I had lost all of the function pretty much. I couldn't drive, I couldn't dress myself, I couldn't shower myself, I was being helped to the toilet, and it was a necessity for me. I don't want to stay like this, I want to be better, and to have the privilege of finding each member of my team that's actually helped me get all those functions back has been a really amazing journey.
And not forgetting Nigel has been a huge
Yes,
part of your team as well.
absolutely.
That's
He has.
Tracy's husband.
That's the same.
And it's good that around the country we have lots of other people like Emma and Gina who have come on board and are helping other patients in the same situation. And it is really, really important to have this sort of a team set up right around the country. Those who have the best teams with them actually do best with their outcomes as well.
I'm trying to behave. I get told that I'm not allowed to do things and try and comply as much as possible, but sometimes, you can just forget. I think for most of my life I self-managed a lot of my disability, but the injuries that I suffered in 2014 certainly were the catalyst. I couldn't do it alone anymore. I couldn't just do it with one person. And my motivating factor for really driving to try and find a team was I wanted to get my function back. It has been hard and it has been painful and it has been long. It's not been easy, but every time you gain function back, to me, it's worth it. I got misdiagnosed with multiple sclerosis.
Yeah.
I got misdiagnosed with fibromyalgia,
Dystonia.
I got misdiagnosed with so much that by the time I got the diagnosis that was actually fitted me, and I actually did fit the box, a lot of people had given up.
Tracy and one other patient were a huge impact on my knowledge. And rather than say go away and live with it, I said, okay, let me go and find out about it. And my radar went up, and the ability to treat not just the musculoskeletal aspects, but also the gastrointestinal aspects, the cardiovascular aspects, the genitourinary aspects, all those other issues started to come into the foreground.
One of the most important aspects of it has always been, and probably will always be, Tracy's attitude.
Yeah.
And her
100%.
approach to both her condition and how she manages it. Because I'll be honest, like the amount of pain and the amount of difficulty Tracy's faced in the last 4 years I've worked with her, her attitude and motivation are still really important to acknowledge. Because we can't make someone do something. We can support them, we can help them,
Yeah.
we can make things better or easier, but we can't make someone do something. And this is very much a self-reliant program, even with the team support.
What Emma mentioned about giving up is really important.
Absolutely.
There are people who come to me who are on the verge of suicide, and with help from the multidisciplinary team that they get around them, we have turned their lives around and brought them back from that brink. And it's not all my work. It's the work of each individual and the teams together that gets there. And it really is important to note it's a team effort.
Yeah.